High blood pressure doesn't usually announce itself. There's no warning sign, no pain signal, no clear moment when you realize something is wrong. For many people, it's discovered during a routine checkup, and by then, it may have been quietly stressing the heart, kidneys, and blood vessels for years. The encouraging news is this: blood pressure responds quickly to lifestyle changes, especially dietary ones. While medication is sometimes necessary, food choices can make a meaningful difference in a surprisingly short amount of time. This isn't about extreme diets or fads. It's about giving your body what it needs to relax blood vessels, reduce fluid overload, and restore balance. Why food has such a powerful effect on blood pressure? Blood pressure is influenced by three main factors: blood vessel tension, fluid volume, hormone regulation. Certain foods directly affect these systems. Some relax blood vessels. Others help your kidneys remove excess sodium and water. Some reduce inflammation that stiffens arteries. When the right foods replace the wrong ones, blood pressure can begin improving within days to weeks. The first step: reduce sodium, but don't panic. Excess sodium causes the body to retain water. More fluid in the bloodstream means higher pressure on artery walls. You don't need to eliminate salt completely, but you do need to cut hidden sodium. The biggest sources aren't salt shakers. They're packaged foods, fast food, processed meats, canned soups and sauces. Simply cooking more meals at home and avoiding ultra-processed foods can lower blood pressure noticeably in a short time. Potassium-rich foods, the fastest natural helper. Potassium helps counteract sodium's effects by encouraging the kidneys to excrete excess salt and relax blood vessels. Foods high in potassium include bananas, sweet potatoes, spinach, avocados, beans and lentils, tomatoes. Increasing potassium intake through food, not supplements unless advised, is one of the fastest dietary changes for improving blood pressure. Leafy greens, natural vasodilators. Dark leafy greens are rich in nitrates, which the body converts into nitric oxide, a compound that helps blood vessels relax and widen. Top choices include spinach, kale, arugula, Swiss chard. Better blood vessel relaxation means lower resistance and lower blood pressure. Adding 1 or 2 servings daily can have measurable effects. Beets, small food, big impact. Beets are one of the most studied foods for blood pressure reduction. They're high in natural nitrates, which can improve blood flow and lower systolic blood pressure relatively quickly, sometimes within hours of consumption. Roasted beets, beet juice, unsweetened. Grated raw beets in salads. This is one of the few foods known to have short-term measurable effects on blood pressure. Fatty fish and omega-3s. Omega-3 fatty acids help reduce inflammation and improve arterial flexibility. Fatty fish such as salmon, sardines, mackerel have been linked to modest but consistent blood pressure reductions when eaten regularly. Aim for 2 servings per week for long-term benefit. Berries. Small, protective, powerful. Berries are rich in flavonoids, antioxidants that support healthy blood vessels and reduce stiffness. Blueberries, strawberries, and raspberries have all been associated with improved blood pressure control. They're also low in sugar compared to many fruits, making them ideal for heart health. Whole grains. Instead of refined carbs, refined carbohydrates spike insulin, which can cause sodium retention and increased blood pressure. Whole grains such as oats, brown rice, quinoa, barley support better insulin sensitivity and reduce vascular strain. Oats in particular have been shown to lower blood pressure when eaten regularly. Nuts, seeds, and magnesium. Magnesium helps regulate blood vessel tone and nerve signals involved in blood pressure control. Foods rich in magnesium include almonds, walnuts, pumpkin seeds, chia seeds. A small daily portion can contribute to steadier readings over time. What to limit for faster results? To lower blood pressure more quickly, it's just as important to remove what raises it. Sugary drinks, excessive alcohol, processed snacks, cured meats, fast food. These foods promote inflammation, fluid retention, and vascular stiffness. Lifestyle factors that boost food's effect. Diet works best when combined with daily walking or light exercise, consistent sleep, stress reduction, adequate hydration. Even small improvements in these areas amplify dietary benefits. Important medical note: if you have diagnosed hypertension or take blood pressure medication, never stop or change treatment without medical guidance. Dietary changes can improve readings quickly, and medications may need adjustment to prevent low blood pressure. Lowering blood pressure doesn't require extreme measures. By reducing sodium, increasing potassium-rich foods, and choosing whole, plant-forward meals, many people see improvements faster than expected. Food is not just fuel, it's information for your blood vessels. If this helped you, subscribe for practical, science-based health guidance. And always partner with your healthcare provider for personalized care. Your heart will thank you.